Good afternoon, everyone. Welcome to the COVID-19 New Crisis, Same Story series. In episode 3, we heard from nonprofit leaders across the country focused on disrupting racial economic inequality by pivoting their service delivery to equip people with the skills and supports needed to thrive in the workforce and challenging the systems that inhibit their access to opportunity. More of their voices and experiences are captured in our new report, COVID-19 New Crisis, Same Story, highlighting the innovations to racial economic inequality from leaders of color. In today's episode, we are furthering that conversation by focusing on income. The fourth episode in the Racial Economic Equity series introduces community leaders in Wilmington, Minneapolis, and Miami who are working to disrupt racial economic inequity by advocating for livable wages and income support that allows people to save in order to accumulate assets and wealth. In today's episode, we will review how COVID-19 has highlighted underlying income inequality conditions across the country. We'll discuss the structural, systemic, and institutional factors that exacerbate poverty in communities of color. Lastly, we'll close by reviewing solutions in both policy and practice that will help to align investments with community needs. And with that, let me introduce you to today's speakers. Today, we're joined by Ebony White, who is the Associate Director of Racial Wealth Divide Initiative at Prosperity Now, and she will be moderating today's conversation. We're joined by Rashmi Rangan, who is the Executive Director of Delaware Community Reinvestment Action Council. We're joined by Nasibu Sadeva, who is the Executive Director of the African Development Center. And lastly, we're joined by Gypsy Mateas, who is the Executive Director of Saint La Haitian Neighborhood Center. And with that, I'm going to move it over to Ebony to get started with today's conversation.
Thank you, Tupa. The coronavirus pandemic is presenting unprecedented challenges in our society, especially for communities of color. As a result, we are facing a health crisis and an economic recession simultaneously. Income disparities have been evident in communities of color for many years. Income is money, and it impacts our security, the choices you have, the risks you can take, the financial shocks you can weather, and an individual's ability to just provide for themselves and their families. Today, we will discuss structural, systemic, and institutional factors that are driving income inequalities in communities of color. While COVID-19 impacted everybody, it did not impact everyone equally. If you look at the impact of this pandemic on people of color, we see that Latinos, Blacks, and immigrants have been hit the hardest for job loss and pay cuts. According to the Pew Research Center, over 70% don't have rainy day funds compared to 47% of white Americans. In a recent Prosperity Now report, The Unequal Impact of COVID-19 on Households' Financial Stability, data reveals that Blacks are roughly 50% more likely to be paid wages at or below the federal minimum wage. And we also see that immigrants of all ethnicities are more likely to work in service sector occupations. So it's no surprise that the data is showing us that people of color is carrying the burden of this economic shock. When looking at both history and data, what we are seeing in communities play out is predictable and is also preventable. We cannot discuss poverty, economic inequality, and COVID-19 without not discussing that there are underlying structural, systemic, and institutional income inequalities that needs to be addressed. We have an opportunity to not only shed light on what is not working, but to create a new way of investing, advancing, and partnering with low-income individuals and communities of color. Income disparities are complex, so we need multiple approaches and solutions. From the macro level, looking at laws and policies, to the meso, where our organizations and institutions come into play, to our micro, looking at individual experiences. So today we will be hearing from a few of our partners who are working on the ground in communities of color, providing a multitude of services during these challenging times. We heard from our leaders that there are an increase in families needing their services, many who are already struggling pre-COVID and are just trying to have their basic needs met. We also know that organizations are finding themselves going above and beyond to meet the needs of their clients, many doing more with the same or less. We know that there are 3 levels of intervention: prevention, harm reduction, and economic advancement. In today's conversation, you will hear different ways in how these leaders are responding during this pandemic and how they are bringing forth solutions and recommendations across these interventions to advance income equity. With that, I want to welcome our guests today. I have a 4-part question for all of you. Let us begin with Rashmi in Wilmington. What is the data telling you? What are you hearing and experiencing with your clients? And how have your organization adjusted and what support is still needed?
Thank you, Ebony, and thank you, Prosperity Now, for lifting this issue and most of all for lifting us. Even before the pandemic, 40% of Americans couldn't handle a $400 emergency. During the pandemic, emergencies are so much greater than $400. While there are many factors determining the COVID-19 related deaths in a nation, one emerging one is higher the income and wealth disparity, higher the COVID-19 related deaths. Inequality kills, and we must do something about it. DCREC is a nonprofit in the business of transforming financial lives through 4 programs: advocacy, a community federal credit union, a nonprofit law firm, and money school. COVID-19 has had a significant impact on us, as it has on everyone. Like our clients, we have to work twice as hard with half as much. Income and wealth inequality is not new. When DCREC was founded in 1987, a Black person was 7.5 times more likely to be denied mortgage than a white person. That has a ripple effect. In 2015, the median net worth of homeowners was 80 times larger than the median net worth of renters. Occupy Wall Street movement of 2011, very recent, was built around economic equality as well. How did our world change mid-March? We had to learn new stuff and how to deliver that new stuff to our target audience. Unemployment insurance, the economic impact payments. We needed to help our clients set up things such as emails, download banking apps, and how to use them. We had to help with wills, powers of attorneys, and healthcare directives. Money school classes that were more relevant. We applied for PPP loans, and our credit union was able to turn on a dime and offer PPP loans to nonprofits and small businesses. Certainly legislative advocacy, we saw an uptick there. And like everyone, we've been Zooming. We have been going virtual where we can and figuring out ways where we simply cannot. Our work takes so much longer these days simply because of the situation we find ourselves in. What have we learned? Our clients may not have reliable technology, or if they do, they may not know how to use it. People are genuinely scared, not knowing what tomorrow will bring. Stepping stones ought to be the primary financial institution. Legal services are critical. Money management ain't a priority when you're worried about surviving and seeing daylight tomorrow. We've always met our clients where they are. Some little things that could help shape our tomorrows. APR above 36% ought to be prohibited. It is a crime on the poor. In Delaware, we are asking for 2 little things: $1 billion fund to benefit the low and moderate wealth Black and brown families, and an equity commission made up of the same communities and are adequately compensated. Of individuals, we want to make sure we circulate the dollar in the Black community longer than just 6 hours compared to other communities 15, 20, 30 days. For our own organization, we certainly ask for time, talent, and money. And please learn about us, dcrac.org. And if we can help your clients, reach out and we will be there to help. Thanks, Ebony, so much.
Thank you, Rashmi. You said something that stood out in that, like your clients, you work twice as hard with half as much. That really speaks to our belief on the Racial Wealth Divide Initiative, and that most nonprofits in communities of color that's led by people of color are just as disinvested in as the community that they are serving. And what's also clear is that you prioritize your clients' needs above anything else, especially when you're trying to determine what kind of support they need, even if it means doing more with less and working in traditional ways. And so I also would like to point out, given the fact that you were a PPP loan recipient, it would also great to hear that you was able to position yourself to provide them, given that we also know that businesses, specifically small businesses led by people of color, are also having a challenging time as well. And so on this note, I would like to turn to Nasibu in Minneapolis, whose work is around supporting small businesses and individuals within the African immigrant community. Please share with us the impact of this pandemic on your clients, what data is showing you, how you are responding, and what can make your work stronger.
Thank you. Thank you so very much, Ebony, for moderating these discussions. Thanks, my colleagues, Rashmi and Gipsy. Since the inception of the African Development Center, ADC has emerged as recognized leader in our marketplace for our central role in providing effective and cultural competent support services to African communities, new Americans. Let me tell you a little bit about the organizations before I tackle a little bit of what we've done during these challenging times. The African Development Center, ADC, was started in 2004 by and for African immigrants and refugees. ADC was launched because existing economic development organizations lacked the resources to address financial, cultural, and language barriers that hinder African immigrants from achieving self-sufficiency. We have a very successful formula for reaching a high needs community of minority, especially borrowers, that is difficult for others to serve. This deep sense of core cultural competence is the core reasons for our success and for the trust we enjoy in African immigrant community. Our ADC's board-approved mission is to grow business, build wealth, and increase reinvestment in the African communities of Minnesota through a comprehensive set of services in financial literacy, business development, and home ownership. ADC provide culturally competent resources to Minnesota growing African community. Minnesota African immigrant community is vibrant and growing with history of self-sufficiency and entrepreneurship when given the proper support like the one they received from ADC. In 1990, fewer than 5,000 Minnesota residents were African born. Today, over 150,000 African born immigrants call Minnesota home. Of 15 US metro areas with largest foreign born populations, ours in Minnesota has the second highest proportion of immigrants from Africa. Over 20% of Minnesota foreign-born populations are actually from Africa. According to the census data, the poverty rate for all Minnesotans in the last couple of years was 10.1, of which for our counterpart whites was 7.6. This number was lower than the US rate. Yet for blacks, the poverty rate was 30.4. more than 3 times the state average and 4 times the poverty rate of white Minnesotans. Because of all these numbers, in 2019, 46% of loan dollars that has been deployed by ADC, and 52 of transactions from ADC were actually in high poverty census tracts, and we've been doing that very intentional. Minnesota overall unemployment rate for 2018 was lower than the US rate at 3.9%. For African American in Minnesota, the comparable unemployment rate, while the US was 3.9, the Minnesota was 9.9, more than twice state figures. And for Minnesota largest African population groups, the Minnesota State Demographic Center found in a few years, around 2006, unemployment rate was as high as 19% for Somalis, 16% for Liberians and Ethiopians, natives and their children. These are just some of the African communities here in Minnesota. Why am I actually highlighting all these numbers? ADC is dedicated to the economic empowerment and success of African immigrants in the States. And the reason why I'm highlighting these numbers, because if we are not creative, innovative, then we're not going to be able to curb inequalities. And through entrepreneurship, we have been able to actually support to curb these inequalities. Let me share a few numbers that as what we've done at ADC. ADC has deployed over $13 million to over 600 clients. And these clients have injected, leveraged almost $24 million to these small businesses. Almost 3,000 jobs have been created or maintained, of which tells you it's about 200 jobs that have been either created or retained averagely per year. ADC is planning to scale up its lending portfolio. My intention is to work aggressively and smart to make sure that we are at least 20 or over $20 million of portfolio within the next 2 years. Let me talk a little bit about COVID. During this COVID, ADC has worked with other partners to be able to help our community to support to be able to do applications, either federal or state applications. This includes SBA IDOs, PPPs, DEED, State of Minnesota's emergency loans. ADC was creative in being able to deploy about $1.5 million within 3 weeks. And all this funding went to small businesses, between of which we supported businesses between 2,500 to 35,000 to about 60 small businesses. Due to unrest that has just happened, there were over 200 businesses that were affected with the unrest, and 2/3 of these businesses were actually immigrant-owned businesses. And we have been working very closely with these businesses to make sure that we support them by either giving them loans or grants. As I'm speaking to you right now, we were able to approve about $5 million to support these small businesses that have been affected on the Lake Street commercial corridor. Again, we have to continue to be creative, innovative for us to be able to support our communities. Thank you so very much, Ebony.
Great, thank you, Nasibu. You raised a good point, around the unrest that we were seeing around our cities in response to the killing to George Floyd. We have a crisis within a crisis. And Minneapolis, being ground zero, has not only been the center of this injustice, but the community has been in unrest the longest. And so we don't really know the ongoing impact of COVID-19. But what I appreciate about your comments is that you already are looking into the future, and you're foreseeing that there can be a negative impact if we don't support our small Black businesses, to not only be able to weather the storm, but to really be able to, be on the other side of the storm. And so we know that all businesses have not been impacted by COVID-19 equally either. SBA just released on Monday that Black-owned businesses just received less than 2% of PPP loans, compared to 83% for white-owned businesses. And this is only reflecting a small percentage, but I'm pretty sure it's probably reflecting, the whole number once we look at all of the data. And so your concern is definitely valid. Lastly, let's hear from Gypsy of Miami. You are providing an array of services to the Haitian community. Talk to us about how this is paying off for you.
you very much, Ebony. Good afternoon, everyone. So to quickly agree with what my colleagues Nassim and Nasibu have put on the table so far. And so Haitian Neighborhood Center Saint-Lac is a 20-year strong agency specializing in serving the local Haitian immigrant community here in South Florida, a community that's assumed to number about 130,000 based on 2010 census, but we know very well that the numbers are actually closer to 300,000. But so our mission is to really educate, uplift, stabilize our communities to ensure that they succeed as immigrants, right? As all of us want to see our respective communities succeed. And our line of work, which has been about many of the similar services that my colleagues offer, but really focusing on ensuring that people have the tools, the skills, the information to access services and benefits that would help them advance. And in so doing, I think COVID has laid bare for all of us the dependency that our clients have on us as an organization, precisely because of their lower educational attainment, their technology gap, their weak English language skills. And so we continue to be their lifeline because they're lacking in these areas. And since COVID, of course, you know, this is already a population that was overly represented, if I could say, in the service sector, right? With over 40% of residents being employed in one or another service sector jobs. This is a population that even when they are homeowners, over 58% of them were already cost burdened before COVID, right? This is a population that was again had suffered the higher or among the highest unemployment rates. This is before COVID, right? And of course, similar disparities that other Black and Brown communities face, but really exacerbated by their status as immigrants, right? Their status as immigrants, either sometimes because they're not tapping into resources for which they're eligible out of fear, and often because they're incapable of doing so on their own for lack of English language and technology skills. And so what we have come to face at this particular point is the need to create a pilot program that we would call a technology lab to provide upskilling, training, and support to our clients such that when they understand that technology is going to rule their lives from this day forward. If it hadn't done so before, I think they're seeing it now because of people's inabilities to apply for unemployment benefits, to apply to ensure that they get all the benefits that they deserve, certainly. It shows us that we have to do some additional work in addition to awakening them to the various systemic and institutional barriers that impact brown and Black people in the very same ways, right? And so for us, this technology lab we would need very much thought partners, individuals who serve immigrant communities and understand the dichotomy between English language skills and weak native language skills, people who understand how to design tech programs for beginners, tech programs for people who sometimes wouldn't even know how to turn on a computer, right? So these are people who are facing the traditional digital divide that we often speak of, but in ways that are much deeper and much more profound, because if we don't help to upskill them, if we don't help to train them, they will be left behind in this economy. So beyond the thought partners, the resources, and I'm talking financial resources here, in addition to experts in education and technology training and equipment, right? Such that we might have a lab that has various elements of the technologies that our communities are gonna have to face, have to embrace, and have to really do well in order to thrive and the new normal and beyond, right? So let me stop right here such that we can have additional comments, but thank you, Ebony, and thank you all.
Yes, great. Thank you, Gypsy. Technology has played a major role during this crisis. It allows us to be able to engage with others, to work, to access information, to learn and train, as you mentioned. But why it's so entrenched in everything that we do, you lifted up some good points. Actually, all three of you did around the fact that many people don't have access to it and many people don't understand it. So there's definitely a digital divide as we're looking into how technology will continue to impact our lives. It's so great to hear, though, about how you have been innovative in your technology lab idea, and that, given that that technology is not going around, being able to tap into things like smartphones, for example, something that everyone have, it could really be something that's not only good for your clients, but also a good thing from a business perspective. So, what I want to do is, just kind of talk a little bit about what I've heard around what could really make your work stronger, what could really help your communities. What I heard is that, it'd be great if we can think about really utilizing a standard low APR rate. You guys are also mentioning the fact that you want people to get to know your work because you need more partners, as you're continually looking to expand your work. And technology, we need training, we need support around ways to be able to reduce the technology divide, especially around language barriers. I also heard that we need more funding. We need loan providers to be able to remove the red tape so that those who need it most could really grab it. And lastly, one of the things that I would say that I would want to lift up is that we need to support our Black and Brown businesses. We need money to circulate longer in our communities. And so with that, I want to thank you all for agreeing to engage in this conversation, for talking about how structural and systemic racial inequalities are impacting your communities. I want to thank you for shedding some light on how this pandemic is truly having a multiplier impact on communities, and how you're not only responding to the greater needs of today, but you're being innovative, you're being proactive by trying to get in front of some of the future barriers that you foresee. It's important for Black and Brown people to not only survive this, but to thrive. And by having livable wage jobs and opportunities for wealth building, we have an opportunity to make real change here, to create a new normal. We don't want to go back to how it was. We need systems, policies, and practices that really support income mobility and prosperity for all. I want to thank you all, Rashmi, Nasibu, and Gypsy, for sharing your insight and expertise with us. I appreciate you and all the work that you are doing. For others, please join us for the next episode airing July 29th, when my colleagues will discuss the connection between COVID-19 and the inequalities in housing. Thank you, everyone.